Blood pressure too high? Your brain is at risk. Do this now. When blood pressure rises too high, it does more than just make your heart work harder. It quietly damages delicate blood vessels in the brain, increasing the risk of memory loss, cognitive decline, and even stroke. This is why acting early matters. Gentle steps taken today can protect your memory, balance, mood, and independence tomorrow. For more step-by-step senior-friendly tips, you can always visit thevutitrack.com to find resources made just for you. In this video, we'll walk through 7 key signs and daily actions you need to know. Number 3 may surprise you because it often goes unnoticed. And number 1 is the single most powerful step you can take to protect your brain for years to come. 7. Morning headaches that do not fade. When blood pressure is high through the night, it puts pressure on the blood vessels in the brain. This often shows up as a dull headache at the back of the head first thing in the morning. Many people brush it off as bad sleep or stress, but these headaches are a warning sign. If the pain is frequent or stronger than usual, it is your body's way of saying something is off. High nighttime blood pressure prevents your brain from resting and receiving steady oxygen flow. Over time, that affects your ability to think clearly and can increase the risk of a small or major stroke. Gentle changes can help. Keep your sleep routine steady. Go to bed and wake up at the same time each day. Avoid heavy, salty dinners and late-night caffeine. If you use more than one pillow, consider adjusting it to keep your head level, not propped too high. This improves blood flow and lowers pressure in vessels. Stay hydrated during the day, but not too close to bedtime. And most important, track these headaches. If they occur more than a few times a week or get worse, speak with your doctor promptly. Treating nighttime blood pressure early protects your brain. 6. Blurred or shifting vision. High blood pressure can quietly damage the small arteries behind your eyes, leading to moments where your vision seems blurry, hazy, or even flickers. This is not just an eye issue. It is often an early sign that blood flow to the brain is affected. The blood vessels in your eyes are some of the smallest in the body, so they react quickly when pressure is high. A sudden blur while reading or watching TV should not be ignored. One gentle step is to rest your eyes and breathe deeply to calm your nervous system. But lasting protection comes from addressing the pressure itself. Reducing extra sodium, walking daily, and sleeping well can make a real difference. Mr. Carter, a retired school principal, used to ignore these blurry spells thinking it was just age. But after a stroke scare, his doctor explained that these episodes were tiny warnings from his blood vessels. Once he made simple adjustments to his daily habits, his vision steadied and his risk dropped. If you notice your vision changing, keep a written log of when it happens and how long it lasts. This helps your doctor find the right steps quickly. Your eyes can offer clues long before major brain symptoms appear. 5. Dizziness and lightheadedness. Feeling dizzy when standing up or walking short distances can mean your brain isn't getting steady blood flow. High blood pressure may seem like it would increase flow, but over time, it actually damages the lining of your arteries, making them stiff. That stiffness means blood doesn't adjust well when you change positions, so your brain feels it right away. Many seniors wave this off as normal aging, but it is not something to ignore. Gentle steps can help. Rise slowly from sitting or lying down. Take a few deep breaths before you move. Make sure you drink enough water, especially if you live in a warm area or take medications that increase urination. Short daily walks keep your blood vessels flexible. Dizziness is not just uncomfortable, it raises the risk of falls, which can lead to serious injuries. If you notice this happening more often, check your blood pressure at different times of the day, not just in the morning. This gives your doctor a clear picture. Small daily habits can reduce the spikes and dips that strain your brain. Addressing this early helps protect balance, memory, and independence. 4. Forgetfulness and foggy thinking. When blood pressure is consistently high, the small blood vessels that feed oxygen to the brain's memory centers can narrow. This affects how clearly you think. Simple daily tasks may start to feel fuzzy. You might misplace things more often or forget details you usually remember. Many people blame this on aging, but uncontrolled blood pressure is a major reason why this happens. Gentle steps can make a difference. Keep your blood pressure readings in a small notebook or on your phone. A daily 20-minute walk can help keep blood flowing steadily. Reducing processed salt and sugary drinks also supports better brain function. Evelyn, a 72-year-old grandmother, used to feel frustrated because she would lose track of conversations. Her doctor found her blood pressure was often high in the afternoon. Once she adjusted her meals and started walking after lunch, the fog lifted noticeably. If you notice mental fog creeping in, don't ignore it. Clear thinking is tied closely to blood flow, and blood flow can improve with simple daily habits. Join our Healthy Habitat membership today to receive weekly printable plans, gentle brain and heart routines, and trackers you can follow at home. Plus, you'll be part of a warm, supportive community that makes healthy habits easier to keep. 3. Numbness in hands or face. A sudden tingling or numb feeling, especially on one side of the face or in your hands, may be a sign of rising blood pressure stressing the vessels in your brain. These sensations may last only a few minutes. So many people brush them off. But this can be an early warning of a transient ischemic attack, sometimes called a mini stroke. It means your brain isn't getting steady blood flow. George, a 68-year-old veteran, first felt a pins and needles sensation on the left side of his face while shaving one morning. He waited it out, thinking it was nothing. When it happened again 2 weeks later, he went to the doctor and learned his blood pressure was dangerously high. With quick treatment and daily lifestyle adjustments, he avoided a major stroke. If this happens even once, it's a reason to call your doctor or emergency services right away. Time matters. Beyond medical care, steady routines, such as gentle morning movement, balanced meals, and consistent medication timing, help reduce sudden spikes that strain your brain. Do not ignore numbness, even if it fades quickly. 2. Ringing in the ears. Many seniors notice a high-pitched sound in their ears, often called tinnitus. While this can come from other causes, high blood pressure is a common trigger. When pressure rises, it pushes against the delicate vessels in your inner ear, which are closely linked to balance and sensory signals. This ringing can grow louder at night when it's quiet, making sleep harder and stress higher. Gentle daily steps can lower this pressure. Reducing salt, moving more, and calming your mind before bed all support your vessels. If ringing pairs with headaches or dizziness, it's even more important to get your blood pressure checked. Some seniors also find relief through soft background sounds at night, like gentle music or a fan. This isn't just about comfort. When your ears ring, your vessels may be speaking up before your brain shows clearer signs. Listening to your body and acting early protects your brain long before damage builds. 1. Shortness of breath while resting. When blood pressure is high for too long, it can strain both your heart and your brain. Over time, this makes it harder for oxygen to circulate fully, and you may feel short of breath even when sitting still or lying down. This is a serious red flag. It means your heart and brain are working overtime. Some people describe it as needing to take deep breaths more often, or feeling like the room is warmer or closer than usual. Linda, a retired nurse, felt this at night but dismissed it as age catching up with her. Her doctor later explained it was her blood pressure quietly pushing her heart and vessels too hard. Once she started a steady, low-salt diet, daily movement, and regular pressure checks, her breathing eased. If shortness of breath happens often, it's important to call your doctor immediately. This sign can mean your brain is not getting enough oxygen-rich blood. With proper care, many seniors regain their comfort and energy. Protecting your breathing protects your brain too. If your blood pressure has been running high, taking steps today can change tomorrow. You can find more senior-friendly guides, practical trackers, and gentle step-by-step routines at thevitatrack.com to support your brain health and overall well-being. Joining our membership also gives you exclusive weekly plans, easy-to-follow trackers, and a community that cheers you on every step of the way. Your brain matters. Protecting it starts with small, steady actions today.